First of all, thanks for inviting us to join this very interesting and important conversation. Like Julie mentioned earlier, so our focus is testing is part of our integrated approach. But today we're going to talk maybe a bit more about the integrated approach and what do we plan to really roll out this approach in our project. So this is just a quick reminder. I think everyone is familiar with this. Just wanted to put the project in the context of this time frame. So in 2018, when WHO, Dr. Tedros announced the call to action for cervical cancer elimination, UNITAID, who's our donor, also announced a call for proposal for elimination of cervical cancer, and especially focused on secondary prevention strategies in bringing innovation to lower and middle income countries with a focus on women living with HIV. And even before the 2018 call from WHO, the Global Fund, back in 2015, through their board meeting, they have published decision on considering HPV infection as co-infection for HIV and cervical cancer as comorbidities. And these are really clear guidance providing countries funded by the Global Fund the possibility to request funding in their every 3-year cycle of funding request interventions on HPV, HIV co-infection, and also looking at cervical cancer. Again, I think everyone in this group is familiar with this, and this is the reason why we're considering integration and co-testing for HIV and HPV and cervical cancer screening. I think Somesh in a previous meeting has already presented the project briefly. So the success project is Get Up Cervical Cancer Elimination with Secondary Prevention Strategy. The project is funded and supported by UNITAID. UNITAID is a donor that is really aligned with the Global Fund, so on TB, HIV, and malaria. Through this project, this is the first project on cervical cancer. And again, this is HIV co-infection and comorbidity. So the project, Expertise France, is a French government agency, and we're the lead of the consortium. We're really honored to partner with JPICO and UICC. And we are working in 4 countries: Burkina Faso, Cote d'Ivoire, Guatemala, and the Philippines. And the selection of these countries are after a careful discussion with our partners, JPICO and UICC, considering country presence, experience, previous CCAP projects, and also the civil society partner as well. Within the project, we've included 20 more countries in a scope of what we call regional influence, because we consider that our 4 countries can be really regional champions. And the way forward for promoting in the regional influence module is to be finalized pretty soon. Okay, so next slide, please. Great. So I won't go into details on this one, just to give you a quick overview of the project. So we have 4 outputs, and the first one is on implementation research, generating evidence, and second one is on awareness raising and through advocacy and through demand generation. And then the third one is where we will go into more details today, is on the integrated service delivery models. And again, I want to emphasize this is really looking into each country's context. The last output is on mobilizing for creating the conditions for scale up, and also looking at health financing components. And this is what you saw earlier on Julie's presentation, our collaboration with the Economist Intelligence Unit. Next slide, please. Okay, so before we go into talking about how we want to do integrated approach, we want to give some consideration of what we define as an integrated approach. First of all, integrated care, we need to put in together input, delivery, management, and organization of services. And the goal is really to improve services in relation to access, the quality, and user satisfaction and efficiency. how to create, how to break silos and bring all the resources to really making sure that services are delivered in a way that is efficient and for the users. Next slide, please. So how do we, what's our plan? We have three guiding principles in our integrated approach. The first one is we want to look at, so for integration, there's woman-centered and provider-sensitive and system-appropriate elements that we need to consider. In terms of system, we are talking about infrastructures and resources. For provider, we're talking about the skill set and the time. For women is really, once again, is the time and the resources that will require them to come into care. So we will emphasize on implementing interventions that will achieve all three areas. Next slide, please. And like Julie mentioned earlier as well, so our focus, as you can see, is in lower middle income countries. And there are a lot of, many levels of strengthening that needs to happen before we can achieve and really promote and the goal of cervical cancer elimination. So we need to look at national level, that's your policy, guidelines, protocol, and financing structure. We need to look at sub-national level. This can be regional, this can be district, and then facility level of their management, and how to create an environment that could provide coordinated care to ensure continuity and efficiency. And then most importantly, we need to look at a client's perspective. And here we're talking about all the women that will come in to service for how to create this environment for that's most suitable for them and to come into care. Next slide, please. Okay, this is a sum up of the outcomes that we are aiming. Once again, this is woman. This has to be woman-centered, and the key goal here is to ensure continuity of care, coordination of care, and efficiency and the quality. Next slide, please. Okay, so how do we do? So going back to the topic of this session today is on co-testing. So how do we do co-testing? Actually, co-testing, like I said earlier, is part of the integrated approach. So we've thought about when we provide service in whether it's reproductive health clinics, HIV clinic, or primary health centers. If we, for example, when we work in a HIV service clinic, so if a woman come in for a first HIV test, and that's the opportunity for us to offer cervical screening. And vice versa, in a reproductive clinic or in a primary health center, if we are providing cervical cancer screening, we can also provide HIV testing. And this has to go through a really careful counseling, of course, pre and post testing results. So there are many different models that we can consider integration, whether it's a single service provider, for example, like I mentioned earlier, in a reproductive health clinic, and that's where you can provide cervical cancer screening and HIV at the same testing at the same time. That's what we call consolidation. The woman can also go into a clinic where there's already a group of different services available. So this can be internal referral, or we can go into the network of providers. So in our project, we will be actually working with all the different levels of the health system, and also testing in different facility, and to understand what may be best, considering each country setting to propose integration. Next slide, please. So this is to sum up integrated approaches in success. So here we're talking about cervical cancer and HIV, but for us, our integration is larger than with HIV. Like I mentioned, this could be primary health clinic and reproductive health centers. Our goal is really to not create another vertical program, and to see how we can best really integrate horizontally with existing resources. So on the screening and treatment level, we are, in terms of service delivery point, we are looking at really going to HIV service clinics. So more specifically on HIV here, this is what we will be doing, and providing treatment and also training healthcare providers in HIV services on cervical cancer screening, and providing precancerous lesion treatment with thermal ablation. And then on HPV testing platform, this is where a very interesting and really important integration must happen. For example, in our project, we will be working with different providers. We will be working with GeneXpert, ABOT, and Tocoba's platform. So as you may know, in lower middle income countries, for this platform today are mostly used either for HIV viral load or for TB diagnosis, and mostly under a donor-funded program. So how do we, so our goal is to come into working in our 4 countries and really promote on a service provider level, laboratory level, and service supply chain management system. How do we integrate HPV testing into this existing systems? The project is going to start pretty soon in all 4 countries, and we're hoping that pretty soon we will be able to report back our findings. And this is also, these questions are also going to be treated in our implementation research. And then on community engagement, like Julie mentioned, so on awareness raising and advocacy level, we need to work with civil society. And for cervical cancer, we think it's very important to work with HIV civil society and learning from their experience, and also leverage those community health workers who are trained for HIV and should be able to also provide cervical cancer screening information, or even be part of the workforce for self-test. And then the last thing is on financing. In the project, we will be assisting our 4 countries who use the WHO C4P tool for costing, in which HIV is one of the components. And we believe with using this, we will be able to help countries to mobilize resources. Like the slide earlier, the Global Fund is one of the potential resources that we can consider. We can help countries to mobilize in their next round of funding.